trying to get down to the heart of the matter.
Welcome to everyone who has joined us tonight for this event, Matters of the Heart, a candid conversation about sudden cardiac arrest, heart health, CPR, and so much more. And so the Concord Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, the Health and Wellness Committee has organized yet another great event to continue to inform our community. So tonight we have three great panelists who have some very similar experiences and different perspectives about sudden cardiac arrest and heart health. And so we're going to be hearing from them shortly. But before I introduce our panelists, I want to let our chapter president, Bridget Herring Williams, go ahead and give us some greetings.
Good evening, everyone. As an organization of predominantly African-American women, Delta Sigma Theta is uniquely positioned to impact not only the well-being of our membership, but also the families and communities that we serve. And one of our 10 charitable partners is the American Heart Association. Heart disease is the leading cause of death in the United States. And for African Americans, the statistics are even more serious. As we recognize Heart Health Month and Black History Month, Concord Alumni has been intentional about raising awareness through education, advocacy, and being a catalyst of change to help close the gap on ethnic health disparities. Through our series of informational sessions, we hope to inspire others to make lifestyle changes, mobilize communities, and work to improve the health of all African Americans. Thank you to our program planning and development and health and wellness committees. Thank you, Soramika, our moderator, and thank you to our panelists. And thank you to each of you for joining us tonight for this candid conversation, Matters of the Heart. Once again, thank you and welcome. And I'll now turn it back over to you, Sora moderator.
All right. And so, of course, February is American Heart Health Month, but our panelists, they are every day 365 being able to share their experiences in our community about heart health. And so I want to go ahead and start by reading the bios of our three panelists. And I will start with Dr. James Roberts. And so Dr. James Roberts attended Harvard University, where he majored in biology and minored in mathematics and African American studies. He was a baritone singer and officer for the internationally recognized Kumba Singers, while also playing college football. He attended medical school at Columbia University College of Physicians and Surgeons. Upon graduation, Dr. Roberts chose to serve the medically disadvantaged community of Harlem by completing his internship, residency training, and chief residency at Columbia's Harlem Hospital Center. He completed his cardiology training at the Johns Hopkins Hospital in Baltimore, Maryland. In 2015, he completed the professional MBA program at Wake Forest University at the Charlotte campus. Dr. Roberts has been a cardiologist in Charlotte for 25 years, and he has recently been selected as the physician executive for the Greater Charlotte market for Novant Heart and Vascular Institute. He has always been committed to caring for the underserved. In his spare time, he has been the medical director for the Heart Bright Foundation, which serves the medically under and underinsured population of Charlotte with a free cardiac resource clinic. And as a brother of Phi Beta Sigma Fraternity Incorporated, he believes that we all have an obligation to be champions who serve our communities in whatever the best way we can. So welcome, Dr. Roberts. I will also
thank you so much.
You're welcome. You're welcome. Thank you for joining us. We'll get to the presentations after I go through and introduce each of our panelists. Our next panelist is Mr. Johnny Davis. Mr. Johnny Davis, the author of I'm Still Here, From Heart Failure to Heart of a Champion. He is an inspiration to millions around the world. He is a heart disease and sudden cardiac arrest survivor, and he is literally a walking miracle. He is devoted to teaching people how to improve their health and take control of their lives. He works extensively with the American Heart Association as an advocate in an effort to increase awareness about the risk factors of heart disease, diabetes, and strokes. He's been featured in several news broadcasts with Time Warner Cable, sharing his story and helping to increase heart awareness in the community. Mr. Davis continues to be the most sought after speaker and trainers in the health and wellness industry, as well as personal development and business strategy. He is a business development coach and brand partner with Isogenics International. So welcome, Mr. Davis.
Thank you. Thank you so much.
Thank you so much. And last but not least, our panelist, Mr. Omar Carter. Omar Carter is the founder of the Omar Carter Foundation, a nonprofit organization that teaches CPR, AED awareness and educates the community about sudden cardiac arrest. He serves on the foundation's board as chairman and executive director. Omar's passion for CPR and AED training began when his own life was saved by a bystander CPR in 2013. Omar is a graduate of Appalachian State University and UCLA Anderson School of Management Diverse Leaders Academy program. Currently, he is pursuing a Master's of Business of Administration at the McCall School of Business at Queen's University in Charlotte. He is also a senior accountant at a Charlotte law firm. Recently, ESPN released a documentary on Outside the Lines about Omar's sudden cardiac arrest survival story, his former basketball career, and his foundation's impact on the community. As a former collegiate and professional basketball player, Omar is dedicated to paying it forward by volunteer coaching with youth basketball teams in the Charlotte area. He is also a proud husband and dog dad. So welcome, Omar. Thank you guys so much for being here. And so now we will go ahead and allow for Dr. Roberts to give us his presentation, share his background in sudden cardiac arrest and heart disease, and we'll let him go through those and get some questions and answers after that. All right, Dr. Roberts.
Thank you so much, and thanks for the warm introduction. You know, the reason I like to do these kinds of talks is that I believe it's so important for us to get out in the community and educate our folks about the the dangers as well as the opportunities in healthcare and specifically in heart disease. And I think you're in for a real treat when you hear our other two speakers who have actually lived this. So I'm really just going to set the table for them. One of the things that has been very top of mind for many people this month, and this particular heart month, of course, is sudden cardiac death or sudden cardiac arrest, because everybody saw what happened on a Monday night football game with Mr. Hamlin.
Right.
And so, you know, we've gotten a ton of questions about that. I'm sure the Omar Carter Foundation was bombarded. I'm sure they'll be able to share that with you. And so I wanted to spend a little time just kind of talking about what that really is. His situation, of course, was a little different than what normally happens, simply because his was involved with a blunt force hit. But we'll talk a little bit more about what happens to most folks and how you, as somebody in the community, can actually help affect this disease. So if you can start my first slide, please. If we just, there we go. All right. So I'm going to tell you a story of a patient. And this is an actual patient of mine who I saw in the clinic literally the day before his event happened. So this gentleman was a man who had a stent put in his heart about 4 or 5 years ago. He was in the maintenance cardiac rehab program that we have down in Matthews. So he was going 2 days a week exercise, and he came to see me for his annual follow-up and says, everything's going great. I go to rehab. I enjoy it. I'm running circles around the young guys, but lately I just noticed I've been maybe a little more short of breath than I had been. But wasn't, I'm not having any chest pain or anything. Everything's fine. He'd had a stress test a year ago. That was fine. Had an echocardiogram, or ultrasound of the heart that was fine. So I said, well, it's probably nothing. We'll do some usual tests. Go on to cardiac rehab tomorrow. We'll talk about it, and I'll get the test set up. So he went to cardiac rehab that next day. He was on the treadmill. He was talking to somebody, and he just collapsed. So at 9:34 in the morning, he collapsed while he was using the arm ergometer. The nurses at the cardiac rehab ran over to him. They didn't feel a pulse. They didn't have a blood pressure. And so they started CPR. And so they just started doing chest compressions. They weren't able to get an IV in them, so they couldn't do advanced cardiac life support and administer medication. So all they were doing was just hands-only CPR. And of course, in the venue, we had a automatic electrical defibrillator, or AED. So somebody ran and got the defibrillator, put it on him. The device said, his heart needed to be shocked. He was out of rhythm. So the AED delivered a shock. They resumed CPR. So now we're 6 minutes into it, another 11 minutes into it, the device said, administer a second shock. It did. And then he regained consciousness. Actually, one of my partners who was in the office right next door had come over and was doing the resuscitation. So they immediately put him in EMS, sent him to the emergency room. An EKG did not show the class of massive heart attack, what we call a STEMI, or ST segment elevation MI. We'll talk a little bit more about that in a second. So he didn't have to be rushed right away to the cath lab, but we knew this was probably a cardiac event. And so he did get to the cath lab about an hour or so later. They did a heart cath. He did have one artery that had a 90% blockage in it. They put in a new stent. He kept having some funny electrical rhythms, and so we decided it would be best for him to get an automatic implantable defibrillator placed inside of him, so that if this were to happen again, it could deliver shock and prevent this from happening. I kind of used the slide for something else. So the thoughts part was about what people thought about the progression of things. But what I want you to think about with this is two things very important happened in the story. Number one, as soon as somebody noticed that he was unconscious, they felt for a blood pressure and pulse. They didn't feel when they immediately started CPR. And as Mr. Carter will tell you, that is what saved his life. The second most important thing was that he ultimately had an AED that was able to deliver the shock that he needed. And then we certainly found out that this was a cardiac event that could be treated, but we can't predict that this won't happen again. And so that's why he ended up with an implantable defibrillator. Next slide, please. So when they took him to the cath lab, this is what they found. On the left hand, we have an artery that should be shaped like the big C that you see on the right. But his was totally occluded at that point where the arrow is. So they opened that up, and now that's what it looks like after they finished the procedure. So now we've restored blood flow to the bottom part of his heart and all those branches coming off the sides. Next slide, please. And that is, by the way, what usually happens in a heart attack, right? You have complete occlusion of a heart artery that is not generating blood flow to the rest of the heart muscle. So what's really important here? Well, the most important thing is early recognition, right? We need to recognize signs and symptoms of a heart attack or a cardiac event, and we need to move as quickly as possible to expedite the care of the patient. If we take too long, we like to say in our field, time is muscle. The longer it takes, the more muscle is going to die. And so we like to get people certainly into the cath lab within 3 hours of them having pain. But once they hit our hospital, we want them on the cath lab table, and we want to be in their artery within 30 minutes. And that's the time frame that we try to operate within, because we know the quicker we get the artery open, the less damage is going to be for the heart. 85% of the heart damage occurs in the first 2 hours. So without question, we want to be there within the first 2 hours. But any what we call a STEMI center worth its salt will have you in and out of the cath lab within a half an hour or 90 minutes. And our goal is to try to get you in 30 minutes. Arrhythmias or abnormal heart rhythms that can certainly occur as a result of not moving quick enough. People can go into cardiogenic shock where the blood pressure drops very low and cannot come back up, and because the pump is damaged and you don't have the ability to generate a good blood pressure, and that can cause severe damage to the heart muscle as well as other organs. You can lose your kidney function, your liver, you can you lose brain function. And of course, once the heart is permanently damaged, then the heart can develop what we call congestive heart failure because it does not have the ability to pump it strong. So all these things are important, and that's why we want to move as quickly as possible. Next slide, please. And so when you're out in the field and you're with grandma and all of a sudden she collapses, the first thing you're going to want to do is start that CPR and recognize that time is muscle. And so we want to be able to invoke all of these things that you see on the bottom. First and foremost, if you're by yourself, you're going to start that CPR, but you're going to look around for some help. And if nobody with you knows how to do CPR, you're going to say to them, look, I need you to activate EMS. Please go call 911. Get somebody here now. And then you're going to start what we call high quality CPR. We'll talk about that in a minute. If you have an AED, which many churches and many public buildings will have, you tell that person, go get the AED. We need to get that thing. It's very simple to put it on the patient's chest, and it will tell you what to do. All you got to do is just put it on the chest. It will tell you if the patient needs a shock or not, or it'll tell you keep your CPR going.
Mhm.
Once we do that and EMS gets there, then if the patient needs advanced resuscitation, where he needs an IV or some medication or so on and so forth, then they can take over and they can begin that. But you, by just starting that process, have probably saved the patient's life. And then, of course, once we get them to the hospital, they'll get post-cardiac arrest care, maybe get taken to the cath lab, get an artery open, and then they'll be on their way to recovery. Next slide, please. Oops. I think I lost the slides. Where'd they go? Uh-oh, come back here. I'm sorry. Let me see where I went here. I do not see the screen. Is everybody else seeing the screen?
Yes,
There it is.
we
Okay.
can see the same.
All right,
screen.
there it
Mhm.
is. Okay, so a lot of times you'll get in a setting and maybe they'll get resuscitated, or the person's having their chest pain event, and people say, well, for example, in this case, the cardiac rehab center is just across the street from the hospital, and they say, well, I don't want that EMS bill, that $750 bill. Can't I just go across the street myself? I have my wife drive me over. Absolutely not. Why do we want EMS? Because we can't predict that this is going to happen again within another couple of seconds. And you in your car trying to drive across the street are probably not going to be equipped to go ahead and save his life again. So you want immediate and ongoing treatment. You want it to be as rapid as possible. And you want the EMS team can call ahead and say, activate the cath lab, get the heart doctor into the hospital right now. We need to get this patient up to the cath lab. So when they hit the emergency room, the ER doctor is going to take one quick look and make sure they get registered, and then they're going into the elevator and straight up to the cath lab. They are not going to stop in the ER. So that's why you want to get that whole team activated and moving, because time is muscle. Well, they're going to stop for 1 second just to look at the EKG. You don't need to be able to read the EKG to know what I'm about to tell you. What I want you to notice is on the left-hand side, in the left-hand corner, on the bottom, you start to see things that are starting to look like what we call tombstones, or maybe a fireman's hat, right? And so normally with an EKG, the line that you see going across from left to right should be basically flat, except for the little blips in between. But you're noticing that those lines are starting to lift up and start to look like, again, tombstones. And that's what we call an ST segment, because that's the ST segment. Elevation, because it's being lifted up, MI. And when the EMS sees that, they know this is the real thing. This is a completely blocked artery, and they need to go to the cath lab right away. Now, my patient didn't happen to have that, but I suspected that this was what was going on anyway. And so they knew he had to go to the cath lab. And so they start with their life-saving equipment, and they get him to the cath lab as quickly as possible. Next slide, please. So what are signs and symptoms of heart attack? Well, I like to tell people if you have chest pain or you have pain anywhere between your neck and your knees, that can be your heart, and that needs to be taken seriously. The classic chest pain of a heart attack is, the crushing elephant sitting on my chest, squeezing pressure right in the center of the chest, maybe right behind the solar plexus, and it might move up to the neck or jaw, and it might move to the shoulder, and it might go down the arm and have some associated numbness in the fingers. And oftentimes it's associated with cold sweats or shortness of breath, and certainly feel tired, and sometimes nauseated enough to vomit. Oftentimes in women, those symptoms are not as classic. And so women may just tell you, yeah, I just feel a little fatigue, or I just don't feel right, or I got some belly pain, but they're not really even thinking it's their heart because it's not up in their chest, or maybe they have some back pain, or just some indigestion. So women oftentimes present with atypical symptoms. And so that's why I say, if you have potential risk factors for heart disease and you have any kind of discomfort between your neck and your knees, you need to think about it as potentially being a heart attack. Next slide. And so women, as I said, can oftentimes have pain just above the stomach or shortness of breath. They can just be sick to their stomach. They can just be lightheaded or faint, feeling like fainting, sweating. Oftentimes they'll have pounding of the heart and palpitations, and sometimes they just feel tired. But women are much more likely to have pain at rest rather than with exercise. We always talk about the guy shoveling snow and getting chest pain, and that's sort of classic, but women don't have to be doing anything. They can just not feel like themselves. Certainly in the midst of stress, loss of a family member, they just found out that somebody, was in an accident or something like that. Oftentimes women get so-called broken heart syndrome, where they all of a sudden get chest pain that is every bit of a heart attack. And sadly, women often ignore the symptoms because you guys are so busy holding everybody else down. You don't take time to take care of yourself. You say, oh, all right, this will pass. I'll get to it tomorrow. I'll see the doctor next week. No, if you got something between the neck and the knees and you have high blood pressure, diabetes, high cholesterol, cigarette smoking, or family history, any combination of those 5 things, get to the hospital and get this taken care of. Next slide, please. Diabetics in particular have more trouble than other people because diabetics sometimes don't even feel pain. Their nerves don't work as well as other people. So sometimes diabetics will not complain of pain, but they'll complain of weakness, tiredness, feel short of breath. They too might get lightheaded. They'll have the pounding or rapid heartbeat. And it's because diabetes affects nerves and affects a lot of other things. And when we start talking about risk, a diabetic in a man is twice as likely to have heart disease, but in a woman it's 4 times as likely as other women to have heart disease. So it's particularly a big deal for women. Why are those things linked? Well, again, I told you the various risk factors for heart disease, and I like to say the big ones are high blood pressure, sugar diabetes, and high cholesterol. I call them the 3 amigos, and I tell people they like to travel in a bunch, usually a bad crowd. So if you got 1, you probably got 2, and if you got 2, you probably got 3. And those things are going to be associated with stroke. They're going to be associated with peripheral artery disease, where you get downstream loss of limbs and everything because you got poor circulation in the legs. All of those things happen more commonly in people who are obese and overweight. So obesity kind of triggers all of that and causes a vicious cycle. So yeah, you need to certainly, if you know you're diabetic, you got to be certain that you're right on top of whatever your hemoglobin A1C is. That's the way we measure whether or not your diabetes is under control. For a diabetic, that number needs to be less than 7%. For somebody who's not a diabetic, that number should probably be less than 6%. The B would be blood pressure. If you have high blood pressure, that needs to be under control. And the C is high cholesterol. If your cholesterol is high, that needs to be under control. The best thing you could do in life is quit smoking. By just quitting smoking, your risk of heart disease is immediately cut in half. Your risk of cancer is almost cut in half. And so just by quitting smoking, that's probably the best thing you can do, better than anything else we could do for you. And we know that, as I said, cigarette smoking is responsible for all of the major illnesses that are leading killers. If you're on medication, make sure you take it. Try to be active. We'd like for you to be exercising 30 minutes a day, 5 times a week. And we definitely want you eating more fruits and vegetables and less red meat and fried food. Next slide, please. So again, older adults are a little bit more likely to have heart disease as well. And it's largely because they have all the things that we talked about, and they've acquired it over time. So age is the one risk factor that we can't change. Everything else we talked about so far, we can change. But as you get above the age of 50, your risk of heart disease goes up, and above the age of 65, it really goes up. And so we can't make you any younger. So that's why we got to change the things we can change. In older folks, shortness of breath, trouble breathing with physical activity, feeling that the heart's pounding, lightheadedness should be taken as a sign or symptom of heart disease. Next slide, please. So what can we do to prevent it? Well, you need to know your numbers. Check your blood pressure. Know that you want your blood pressure to ideally be less than 130 on the top and 80 on the bottom, and at a bare minimum, 140 on the top and 90 on the bottom. Either one of those numbers higher than it should be means that you have hypertension and you probably need to be treated. We might start with just lifestyle changes first, but if they don't work after about 6 months, then you need to be on medication. African-American men, by the time we reach age 45, have about a 50% chance of just having hypertension because it is really a strong genetic link. And African-American women probably are the group in the United States that have the highest incidence of high blood pressure and also the highest incidence of poor treatment of their high blood pressure for a number of factors. They don't get the health care that they should. Oftentimes they get ignored and not listened to. And so there are a number of factors, right? And again, you guys are so busy holding everybody else down that you're not quite taking care of yourselves the way you should be. And we want to change that. Got to get your blood sugar and cholesterol levels also checked yearly. If you smoke, you need to quit. And that may not be the easiest thing to do, but there are a lot of things we can do to help you try to quit. You want to manage your weight with good eating habits and physical activity, and take time for yourself to make sure you're taking care of yourself if you're not right. And if you got these symptoms, call 911 right away. You're not driving yourself to the hospital. Get somebody else, get 911 to drive you there. Next slide, please. So at least at Navant, we have a number of chest pain centers. The hospitals that you see listed up there: Matthews Medical Center, Huntersville Medical Center, Presbyterian Medical Center, and Rowan Medical Center are our so-called 4 STEMI centers, which means if you have a heart attack, you can go there 24/7, and they'll activate that team and rush you to the cath lab. Other smaller hospitals don't have that ability. So if you stop there first, they will say, all right, you have a heart attack. We know what to do, but we can't do it here. We got to transfer you. In the atrium system, the same will be true at obviously Carolinas Medical Center, Pineville Medical Center, and Northeast Medical Center all have the ability to perform STEMI and rush you to the cath lab right away. All their other hospitals don't have that capability. So if you think you're having a heart attack, go to one of the ones that you know, the STEMI Center. That's what we call a primary PCI facility. PCI just stands for percutaneous coronary intervention, which means we can go through your skin, get to your coronary arteries and get them open. Those centers are usually designated by the American Heart Association, American College of Cardiology as a chest pain center. That certification has to be renewed every 3 years, and all of our centers are so certified, and so are atriums. Next slide, please. A lot of educational resources that you can get from us and the American Heart Association. In particular, since you ladies always go red, you need to look at Go Red for Women from the American Heart Association. Has great information. Next slide, please. I think that's all. Oh no. Okay, so yeah, the last thing, of course, we want to talk about is the importance of hands-only bystander CPR. I'm not going to steal too much of that thunder because I know Mr. Carter's probably going to talk about it, but the bottom line is this is what saves lives, right? 436,000 Americans a year die from a cardiac arrest, and the vast majority of them could be saved if somebody just started CPR on the scene. If we wait for them to get to the hospital, it's too late. Somebody above the age of 30, if their heart's not working and blood flow's not getting to the brain, after about um, 10 minutes of being down without a blood pressure, we can't predict if your brain's ever going to work again. We might get your heart back, but you might be a vegetable. And so even though it took him 25 or 30 minutes with Mr. Hamlin, he had the beautiful advantage of being young. And so he still got a functioning brain. But had it been me or, your 75-year-old grandma, that probably wouldn't have been the outcome. They might have got him back, but they'd be in a nursing home. So really, it's very, very important. So if people were able to initiate CPR on scene, 73% of people with cardiac arrest probably could be resuscitated. Another 10% happen in nursing homes. Another 16% or so happen in public settings like a gym or a library or store. So bystander CPR is very important. Unfortunately, only about 40% of people who experience an out-of-hospital cardiac arrest actually get that immediate CPR that they need. This is why the Omar Carter Foundation exists, and he's going to tell you all about that, because the more people we can teach about bystander CPR, the more lives we can save. Next slide, please. And so that's pretty much it. I'll step back unless anybody has a direct question. I'll get out the way and let our other two guests begin their talks, and then maybe we can all at the end answer questions, but I'll do whatever you want to do.
Yes, thank you. Thank you so much. We'll definitely get to questions. If you have questions, please, you can put those in the chat. We will be answering questions towards the end. And so we want to make sure that we get questions answered, and we'll be able to let we'll continue this discussion for about 15 minutes or so afterwards for anyone who wants to stay on a little bit longer. But thank you so much, Dr. Roberts. I think as women, we definitely need to take heed to that information, that some of these symptoms that men exhibit, women, we do not, those symptoms look a little bit differently. So we do have to be mindful of extreme fatigue, the vomiting, the indigestion. All of those things are signs and symptoms that we need to make sure that we're getting properly cared for. So we want to go ahead and move on to our next panelist, Mr. Johnny Davis. Thank you so much.
Well, thank you so much for having me. And before I get started, I just want to say that I am also a board member of the Sudden Cardiac Arrest Foundation. And so a lot of what we do is what Dr. Roberts talked about as well. We teach people the importance of CPR. We also teach people the importance of utilizing an AED, and also provide a community where sudden cardiac arrest survivors can actually get together and really just kind of commune and talk and share stories and shared experiences, because there's something else. There's another side of sudden cardiac arrest that people don't talk about, and that's the psychological and the emotional side of dealing with sudden cardiac arrest, especially for those individuals that were fortunate enough to survive, and also not just them, but their loved ones, their family members that were also affected by it as well. But my story, actually, I'm a sudden cardiac arrest survivor, and my sudden cardiac arrest was actually caused by my heart failure incident. I was diagnosed at 34 years old with idiopathic cardiomyopathy, which is a fancy term for, we don't know why your heart is failing. I'm not a smoker. I've never smoked anything a day in my life. I've never used any illegal drugs. I've been an athlete. I played football and basketball in high school and college. I don't have diabetes. I've never been overweight. And so the typical risk factors that will cause a person's heart to go into failure, I did not meet that criteria, but I was stricken with this weakened heart muscle that actually put me in a situation where I was 24 to 48 hours away from expiring before I actually went to the hospital. And I waited so long to go to the hospital because, like most men, I was afraid to confirm the worst. And I tried to self-medicate. I went on WebMD. I'm researching. I'm trying to figure out exactly what was wrong with me instead of going to the doctor. And I waited so long until my heart situation progressed so bad that by the time I got there, my feet and ankles and everything was swollen, and my heart was only functioning at 8% capacity. So when the doctor told me that I had congestive heart failure, I had no idea what that was. I never heard that term before, but he gave me a simple demonstration. He said, a normal heart squeezes like this, and you're just doing this. And so he shared with me at that time that I qualified for a heart transplant, but because I was only 34 years old, that they didn't recommend that I do that. They wanted to see exactly how my heart would respond with treatment. And so I said, okay, let's do that, because I really was not feeling the idea of them taking the heart I had out of my chest and replacing it with somebody else's.
Mhm.
So over the course of the next 6 years, that was 2006, and 6 years later, well, I should say during that 6-year period, my heart function increased, but it didn't increase back to normal. I was still in heart failure range, but I was functional. I was able to go back to work, and I was able to build my business and things of that nature. I didn't have the energy and the vitality that I did when I was 25 years old, but I was still able to function. And I remember on November 2012, I went to the cardiologist. In fact, Dr. Roberts may know Dr. Jerome Williams. He was my cardiologist at the time. I went to see him and to get my echocardiogram results. And he said to me and my wife, we were at the visit together. He says to me, you know, Johnny, I don't know how to tell you this, but I'm just going to tell you straight. He said, your ejection fraction, which is the measurement of how much blood the heart is squeezing through your body. A normal ejection fraction is around 55 to 70%. He said mine was at 25%. And he said that you can go into sudden cardiac arrest at any time. You need a pacemaker defibrillator in your chest right now. But he said, we have a problem. I said, well, what's the problem? He said, well, because you're 40 years old and you're asymptomatic, your insurance company won't pay for it. So I said, how much does it cost? He said, it's going to cost you about the same amount of money as a luxury vehicle. And that's not including the doctor's fees, the hospital fees, and things of that nature. So you're looking at well over 6 figures just to have this procedure done and have this device implanted in your chest. Yeah. So I said, well, I'm going to go get a second opinion. And he said, okay, but I'm going to tell you, you need this device. And I don't want to see this happen to you. He said, I've been a cardiologist at that time for 12 years. He said, I've seen this happen time and time again. You can be at a red light and you can just die at the red light. Your heart can stop and you can die. You can go to sleep and never wake up. So I went to another cardiologist and got a second opinion, and we titrated my medication and gave me a higher dosage of this particular medication to help increase my heart function. And so not even 30 days later, because this was right before Thanksgiving on Christmas Eve of 2012, I went into sudden cardiac arrest while I was asleep. My wife and I were sleeping, and I went into convulsions, and she thought I was having a bad dream. And she noticed that I did not respond. Thank God she had the presence of mind to turn on the lights, wake up and turn on the lights, and saw that my eyes were rolling in the back of my head. She called 911 immediately, and they told her what to do as far as how to administer chest compressions. Now I'm lying in the bed, so she's giving me chest compressions while I'm in the bed. So I'm going up and down, up and down, up and down, only to witness me take my last breath in her hands and die because my heart stopped. There was a period of over 16 minutes. I had no pulse, I had no oxygen, and my heart was not beating. 4 firemen came over to my home, and each one of them did 300 chest compressions on me. And after that, I was shocked 6 times with the defibrillator. And then they did this relatively new technique on me back then called the cold cool technique, where they literally froze my body down to hypothermic levels to preserve any organ function and brain activity that I may have had at the time. And so I coded on the way to the hospital, I coded in the hospital, and they told my wife on Christmas Day or that Christmas Eve that night that if I survived, that I would be a vegetable because there was so much time that elapsed without me having any oxygen to the brain. Mm. So they were preparing her to be my caregiver because we had just celebrated 2 years of marriage, and here it is, I'm lying dead on Christmas Eve in the hospital. And so there was a prayer chain that went around the world, unbeknownst to me. And I was in a medically induced coma for 48 hours. And on Christmas Day, right before it turned December 26th, I woke up. And it took a while for my brain to reboot and everything. But to God be the glory, I survived that. I spent 9 days in the hospital. I had the defibrillator implanted in my chest. And the insurance company finally did pay for it, but I had to die first in order for that to happen. Wow. And so today, you know, I'm a board member of the Sudden Cardiac Arrest Foundation. I wrote a best-selling book about the whole ordeal called I'm Still Here, From Heart Failure, The Heart of a Champion. And I share with people the experience of what I went through. And I also talk about how to prepare or how to develop your mind so that you can push past and move forward from the psychological and the emotional aspect of surviving such an ordeal. You know, I had a whole near-death experience in the whole 9 yards. And so I share with people, you know, what took place and what transpired there as well. So, I mean, I'm here by the grace of God only, because I'm gonna tell you, I was told that it was a textbook save. And thank God that my wife, she went into immediate action. She didn't run out of the house screaming, help, my husband's having a heart attack, help, my husband is sick, or what have you. She immediately called 911.
Yeah.
And I'm only alive today because she started that process. Had it not been for her, I would be dead right now. And that's honestly God's truth. So everyone did their part. Everybody was where they were supposed to be, and they did exactly what they were supposed to do. And from the firemen, the EMS team, the doctors, everyone tells me and told me that it was a textbook save. So after everyone had done what they could do, my wife told me, the doctor told her, if you are a praying woman, this is the time for you to pray, because there's nothing else that we could do.
Absolutely.
From that point on, God took over, and here it is. I'm still alive today.
Wow,
So,
that's an amazing testimony. Like, you know, and I think you know, having things like this for people to be able to think fast, you know, just like your wife did, and, you know, in knowing what to do, because I think so many of us, we do panic, you know, we try to take things into our own hands, and like Dr. Roberts said, we try to drive ourselves places, you know, but being able to know that, hey, I've got to move fast, I've got to get, you know, the EMT here as quickly as possible. But then ultimately we know that we need to be praying and really relying on our faith in times like this. And you're right. It's just that I'm sure that this has been one of those driving forces behind your whole health and wellness initiative as well. And then being able to support people, encourage them by your testimony of being able to literally die and be able to live now, to be able to share your experience. That is phenomenal. It's phenomenal. And I know that you and your wife and family and everybody's just grateful for your life and what you're doing, and for what you're doing now. We have some questions in the chat, and we'll get to those in just a few minutes, but we do want to go ahead and transition and segue over to Mr. Omar Carter. We know that, you know, all of these having, you know, Dr. Roberts here being able to give us that information about all of these signs and how these things can be hereditary. And then just looking at your experience, Mr. Davis, about you were just kind of in tip-top shape, you know, and we wouldn't think that these things happen. And then, you know, and now we look at athletes who are experiencing, you know, these things. So just your perspective and being able to be here to share that is just invaluable. So Mr. Omar, we'll go ahead and for you to go ahead and get started so we can hear your story and being able to share your experience and all that you're doing in our community to be able to build awareness.
Yeah, sure. Well, first off, it's a pleasure to be here. I appreciate you guys thinking of me, or ladies, excuse me, I should say, and especially on not only Black History Month, but Heart Health Month. And
yeah,
I tell you, every time I hear a story, especially like Mr. Davis's, it's a reminder that, you know, we're not alone. I got chills listening to the story, even though I have my own story. So, you know, to you, brother, I salute you. I'm a believer, and it was nothing but God in both of our paths. You know, for me, I'm a former professional athlete. I won't be too long-winded because a lot of the details that Mr. Davis shared that I'll mention as far as cold, cool, how long I was placed in a medically induced coma, he shared. And I don't want to be redundant, but you know, in the beginning of my story, my journey, when I was 16, I had what's called an athlete's heart. And so athlete's heart is basically my muscle is a little thicker than the usual person, if you will. And I'm 6'5", and so they're trying to compare what would be a normal size heart to an athlete, right? So most of your big guys have a bigger heart. And so I have an athlete's heart, but it's in between what they call hypertrophic cardiomyopathy, which just is a thickness of the heart muscle. And so for 10 years, I was getting checked out. I went to Atrium Health, which was Carolina's healthcare system back then. And I did your ultrasound, your EKGs, your early symptoms to figure out, or early signs, excuse me, to figure out if I had the hypertrophic cardiomyopathy and I needed to stop playing. And so for a 10-year period, from I think 2006, 5, all the way up in 2013, I was seeing, your best sports cardiologist in the nation. I went up to Boston to get seen by Baron Marin, his son, actually, Martin Marin. And so July 9th, 2013 is when I actually had my cardiac arrest. And so I went to Appalachian State University, played in Brazil for about a year from 2012 to 2013. And then I went to Dominican Republic to play as well. And I actually got back to the United States a week before my cardiac arrest. And so July 9th, 2013, as I mentioned, I was actually at a local gym here in Charlotte, North Carolina, the Grady Cole Center, and it was a local Pro-Am game. If you're not familiar with Pro-Am games, it's basically a way where all your athletes, whether you're in high school, college, or a professional athlete, can go back and pretty much just, get some work in and compete. And so I'll pass it to my friend. He passed it back to me. I, threw a lob up, and as I'm backpedaling, I collapsed. And so it was almost, if you've seen the Damar Hamlin video, just to kind of give you a visual, it was kind of the same thing. As I look back at it, and if you have a chance, ESPN did do a story on me, and it's called Omar and Steph. You can see that I actually tried to catch myself. And so ICU cardiac nurse by the name of Kelly Thomas just so happened to be at the game. She hadn't been to a Pro-Am game in 2 years. She showed up 30 minutes late to the game, and she was actually in the bathroom when it happened. And so bystanders knew what to do. They started doing compressions, and when she came out of the bathroom, she noticed, something was going on, and so she kind of maneuvered through the crowd, and she started doing compressions. And similar to what Mr. Davis mentioned, I was shocked 3 times, not 6, as he mentioned. My AED was actually upstairs in a locked closet behind a locked door, and the lady said she would lose her job if she actually went to get the AED in the arena. And nonetheless, like I said, I was shot 3 times and taken to the local hospital. And so I coded, as they call it, or I was unconscious on my way to the hospital, and I was placed in a medically induced coma for 48 hours. And again, similar to Mr. Davis, they do what's called cold cool or hyperthermic. It's a hyperthermic therapy, and they basically, like he mentioned, cool your body down for as long as they can. And I woke up, and the doctor said it never happened. Right? Obviously, it did happen. But after doing tests and everything, I didn't have to go through any rehab physically. But as Mr. Davis said, it was the after effects of what I went through mentally. And so it took about a few months for me to realize, what it was I was going through. Right? I'm seemingly young. I'm 25 at the time. I worked my whole life for what I thought would be me playing professional. And so I knew there was a need there as far as athletes and understanding what sudden cardiac arrest was, the difference between a heart attack and a sudden cardiac arrest, how to learn this or what to know about this life-saving technique, as they call bystander or hands-only CPR. And so I started the Omar Carter Foundation to do just that. I'm a young athlete. I knew if I got out there in the community, especially with Black and brown individuals, I would be able to say, hey, look, here's an individual that this happened to, and you can definitely change your life around if you're able to, if this were to happen to you. And so we teach bystander CPR in the community. We place AEDs in the community. And then just like Mr. Davis and Mr. Roberts, just being that person that, you can go to If you have any questions, if you want to know about an AED or what that is, an ICD that I actually have implanted in my chest as well. And so we have programs on college campuses. We have a CPR ambassadors program. We're tagging Omar as ambassadors. We have 5 colleges that we're on their campus. And what I mean by that is we have a train-the-trainer model where we're teaching hands-only CPR to student athletes who then in turn form a committee to teach their students bystander CPR. And I just want to mention the difference between hands-on bystander CPR and the regular CPR that you're getting is bystander CPR is just me and you. We are able to teach another person how to do it, right? What that means. Where, you know, if you get certified from it, you have to go through a whole class. And so one of the things we want to empower our community to do is say, you know, do something rather than nothing. And that was the notion. You know, what we're finding out as we go out into the community is I have to be certified. I don't know how to do it. I'm scared to do it. I may be liable. And we just let them know that, hey, that's not true. The first 2 minutes, you know, are the most critical. And so one of the things that we want to do, as Mr. Roberts mentioned, is that early recognition is to be on the scene and possibly save somebody's life if it comes to that. And like I said, I don't want to be too long-winded. I know we're at 7:54, but you know, as Mr. Davis mentioned, I'm here by the grace of God as well. The fact that the ICU cardiac nurse was in that place, she actually called ahead to the hospital to let them know that a African-American male was on the way. He suffered a sudden cardiac arrest. So they had a team of people there waiting for me. And then the fact that I didn't have to go through any rehab, right? I hit my head. I could have been in a vegetative state. I could have been in a wheelchair, but I'm here educating others because of his grace. So again, I appreciate the time and it's definitely an important topic.
Oh, absolutely. And, you know, that again is just an amazing testimony. And because you know, how there are so many, you know, these little league teams and so many kids participating in a variety of sports, and so many of these accidents happen. And, you know, I feel like little league teams and how they go through all of the the concussion trainings and things like that. I feel like I have not heard, maybe because I'm not kind of in that sports world so much, but to be able to have these type of trainings for these athletes and the coaches and staff, it's a huge benefit. You know, I think I heard maybe during the Super Bowl or right before the Super Bowl, how I think the NFL had, they were raising money to be able to provide these same trainings, you know, and education for their staff and for those athletes to be able to engage or participate in these and be very aware of what to do and trained because, you know, we know that it happens. So we're so glad you're here and so glad that you are able to help so many people by your foundation. And Mr. Davis and Dr. Roberts, you guys are doing wonderful things. And we appreciate your time and your expertise and experience in sharing that, those things with us. So I'm just going to make sure that we get through some questions that have come up in our chat, but we know that sudden cardiac arrest, we talked about how it affects our family members and our loved ones and the things that they are dealing with after, you know, these types of when these things have happened. So what can you share about that as far as people being supportive of people who have gone through these things?
Me?
Yeah, I'm sorry.
I'm sorry, can you repeat the question? I'm sorry about that.
Just, you know, how people, we were talking about earlier, how just the psychological effects, I think Mr. Davis definitely spoke about it too, but just having the support system, any information to be able to share with our loved ones?
Yeah, sure. Sorry, I didn't mean to cut you off. Yeah, I think for me, and please, Mr. Davis, chime in after me. But for me, it took me a long while to just figure out what happened, right? It was an understanding. It was on awareness piece. And I didn't know what CPR was. I didn't know what sudden cardiac arrest awareness was. To be honest with you, I didn't really know, other than going to the doctor and seeing a primary care, what that was. And so also from a, just working for 25 years to possibly live out my dream of playing basketball, which I definitely got to, that took a toll too, right? You're almost unlearning what you learned for the whole part of your life or what you can remember. And so it's really just trying to figure out how you can cope with it. And I don't really like to use the word cope because I wanted to get through it, right? For me, it was prayer, first and foremost, is to figure out, okay, Lord, what do you have for me? What do you want me to do? Because my mind was focused on this. I think the other thing was to keep other sudden cardiac arrest survivors around me, because for a long period of time, I thought I was the only one. And the other thing that helped me too was the foundation, being able to be in other people's presence, being able to talk with them, and then help them, like a Dr. Roberts or my mentor, Dr. Maida, who's my cardiologist. Therapy was another thing, but it kind of just didn't help me, and I think also just making sure that my mind was there. So it took some years. I'm still dealing with and trying to figure out how do I go about it. I mentioned at the ESPN piece, I was able to meet the 911 operator. I was able to see the story of me fall for the first time, and also talk to the paramedics. And so it's an ongoing thing. And as long as you keep that in the forefront of, like, hey, this happened to me, and keep walking, I think you should be good.
Yeah. You said something that was key. For me personally, I was so detached from it because I don't remember anything about it. I'm only able to tell you this story because my wife told me the story, a million times. So I was detached from it. But for my wife, it was a traumatic experience. And to this very day, she still is, she's triggered by it, and for a long time, she suffered with separation anxiety. It's like she didn't want to be away from me. If I don't answer the phone right away, it's like, what happened? So I have to keep my phone on me all the time. If I don't pick up on the third ring or the fourth ring, doesn't matter where she is, she's coming home to check to see exactly where I am and things of that nature. So it took her a while to kind of get used to the idea that I'm okay, I'm all right. Just because if I don't answer the phone right away, doesn't mean that I had another event, so she won't talk about it. She doesn't like to talk about it today because our whole experience is completely different from mine. On the recovery aspect, for me, it took a while for my brain to kind of reboot. And when I came home, I didn't recognize where I live. I didn't recognize my own home. Once I saw the pictures on the mantle, I'm like, oh, okay, this is where we live. And so it took a while for the brain fog to really kind of like, the brain fog really never went away completely. Even to this very day, sometimes I still struggle with the brain fog. It's like my brain is not as sharp as it used to be. And I can tell, so other people may not necessarily be able to tell, but I can tell that it's not as sharp. And so I work on that every day to get my brain to be as sharp as it used to be, because I did have, there's pockets of my memory that have just been deleted. I don't remember anything. And then, sometimes I feel like I had episodes where, and I didn't realize just how much I really, really needed therapy until I spoke at an event in San Diego a couple of years ago. Being around other survivors, like Mr. Carter said, I wasn't around other survivors. I thought I was the only one. And no one really could relate to what I was dealing with. No one can understand exactly what I was going through emotionally. The emotional aspect of it, I just kind of buried it, which was not the right thing to do. And for me, I just had to come to the realization that I died, and I felt like some days I felt like I don't belong here. Like I part of me should be gone somewhere else. And it's like I got a foot in this realm, I got a foot in this realm, and I'm off. And some people don't understand that. But that's the part that I struggle through and I work through every day, you know, and hearing Mr. Carter talk about how he's still working through it as well, you know, that helps me because I'm able to connect with him on that level and relate to him that I'm not alone. I'm not the only one that's feeling like that. And there are other survivors that are feeling like this as well. And if you've never gone through this, you don't understand. You don't know what it feels like. You can read about it in books, but until you understand exactly, until you go through it yourself, you can never really connect with it the way we connect with it. So, you know, but by the grace of God, we move forward and we deal with it the best we can. And we're still here to do a job. We're still here to fulfill our purpose, and we're doing it with grace, and we're doing it as best we can.
Absolutely. You know, and just by you guys sharing that information, I'm sure, you know, it's trying to navigate this new normal. But I think your book, the foundation, and just being around people and continuing to share your story, I'm sure continues to be, you know, therapy in itself. I just want to mention that in the chat, we do have a survey. And if you could, please, if you get to the survey in the chat, click that link. It just helps us to get more information about the event today and your thoughts about it as we continue to plan other events similar to this. So take time to fill that survey out. That's the link is in the chat. And so we do have a few more minutes. I have some questions that I want to make sure that I address that were in the chat before we close out. And so we had someone ask, this is a question for Dr. Roberts, that why, excuse me, hold on. Okay, here we go. She is asking that she is a lupus survivor, and what are the risks that she needs to look out for in heart disease and with a family history of heart disease and diabetes.
Mhm.
Do you have anything you can share with her?
Sure. So lupus patients make antibodies against their own tissue, and so they have specific things. Clinically, it spares the heart to some degree, but the biggest problem that lupus patients have is that they make antibodies against their platelets, which are the blood clotting cells, and so they're more likely to have problems with clotting. Sometimes they bleed, but oftentimes they clot. And so the last thing you want in the middle of a heart attack is to be able to clot very easily. A very famous lupus type patient was actually, I forget the guy's name, but he was one of the Russian figure skaters. They were a husband and wife team that won the gold medal in the Atlanta Olympics. And shortly after the Olympics, at 32 years old, he collapsed and died of a heart attack. And it turned out that he had a lupus-like antibody that was going against his platelets and made him get a blood clot. It turned out his father had died at a young age of a heart attack too. They exhumed his body and found out that he had the same problem, and it actually saved their child's life. They just had a baby, and the baby had the same problem. And actually, that family came to us at Johns Hopkins when I was there, and we did some genetic testing on their platelets and found this out. So that's one thing that lupus people have to worry about is just clotting. The other thing is women are more prone to having lupus, and they're more prone to have all the things that we already talked about with women. So I think it's the same sort of risk, but you have to be aware of whether or not you make antibodies against your platelets. And if you do, you probably should be on maybe aspirin, but probably Plavix. I do want to get back to the first question, which is that although I am not a survivor, I will tell you that the patient that I presented actually came to see me today. And the first thing he said to me was, you know, I don't feel like I belong here. Is there any kind of support that I can get? Because my wife doesn't understand. I understand. I don't know why I'm here. So I will be reaching out to my other two colleagues here and getting him in touch, because that's a real thing that they all experience. And obviously you guys deal with it every day, but nobody really knows how to deal with it. Right. So I am inspired just to hear you guys and learn something new every time I hear you.
Mm-hmm.
But so thanks for that opportunity.
Thank you. And I think we'll be able to ask, we have one more question for someone in the chat for Dr. Roberts. How effective can a stress test be for someone who has had multiple EKGs and has a family history of chronic heart disease and sometimes has chest pains or other body stress issues?
Yes. A stress test tells you a lot more than what an EKG tells you. An EKG can be perfectly normal, but then we put you on a treadmill or do some other kind of physiologic stress, and the EKG will totally change. So it looks at dynamic changes rather than just what's sitting there when you're at rest. So a stress test is the best way to diagnose heart disease. Nowadays, we have even better ways, right? We can do a stress test on a treadmill, we can do it chemically, we can do it with nuclear medicine. But even now, we can actually do a CT scan of the heart and actually put down your coronary arteries and see it just as well as doing a heart cath without having to enter your body. So there are a lot of different ways now to make a diagnosis. All of them are non-invasive. And, you know, we select them based on what other things that the patient brings to the table. Some people can't walk on a treadmill. Some people can't take, you know, the injections or what have you. So sometimes a CT scan is a better test. So we have a number of ways to figure it out now.
Okay. And so before we close out, thank you so much for that information. Thank you to each of the panelists. But if there is just maybe one thing that you would like to share before we close out, any last words that you would like to share with everybody tonight? Mr. Carter, we can start with you.
No, I just want to say I appreciate the time. Thank you for hearing my story. I think what I will say is obviously, you know, bystander CPR is very important, but I think what's more important is just making sure you keep your health in tip-top shape, right? I think if you don't know, ask questions. Don't be scared. This is your health. Take control of your health. You know, you have great doctors like Dr. Roberts, but at the end of the day, it starts and ends with you. And so I'm here if you have any questions. Mr. Davis, Mr. Roberts is here. I'm sure I don't want to speak for them if you have any questions, but you know, most importantly is health at the end of the day. I know us as African Americans, we are more prone to having these type of diseases, and you know, we already fight other battles. Let's not fight our health. So that's the only thing I'm gonna say.
Absolutely. Mr. Davis?
Yeah, the only thing I would say is learn CPR, get CPR, get CPR certified, learn how to use an AED. It can be the difference between life and death, and maybe even yours.
Absolutely.
Especially children, you know, kids are passing out, playing football, basketball. You know, you need to know exactly what to do.
Yeah.
And I think that it should be prevalent in schools as driver's ed. Before you graduate high school, before you graduate middle school, you need to know CPR.
Mm-hmm.
So I agree.
Recommendation.
I agree as well. Absolutely.
I agree.
So I'll just dovetail on that and say, you know, I'm sorry, I'm actually in the airport and I was passing through TSA, so I had to fall off for a minute. So I'm not sure what was said earlier about CPR. But if to these gentlemen's point, if you don't know CPR, you need to learn it, because the life you save may be somebody very, very close to you. And literally it takes a few minutes to learn how to do it. You just have to learn that you have to push hard and push deep. You need to be 2 inches deep, and you need to have a cadence. And I don't know if Mr. Omar shared with you the cadence that he shared with me. I'm old school, so I was taught staying alive from the Bee Gees. Staying alive, staying alive. But that's each time you get a beat, that's what you want to push on. He's got a better one from Beyonce. I'll let him share that with you. But learn CPR. And we have multiple classes, hands-on CPR. We'll be going throughout the community, doing it this month, next month, also the month. Atrium does the same. Mr. Carter's foundation does the same. So Mr. Davis's foundation does the same. Learn CPR if you get nothing else out of it tonight.
Right. And that was so interesting, because I think I heard that too during the Super Bowl about the Be the Beat and all of these songs that are between like 100 and 120 beats. So yeah, it's helpful for the Save a Life and CPR. Well, it is 8:12. We technically have 3 minutes, but I think you guys have covered a lot. We are like very, very thankful for all of you. We are truly inspired by your stories. We are grateful that you are here today to be able to share your knowledge, your experience, and then being able to just educate our community about it and the importance of it. You guys are heroes, and we salute you, and we appreciate your time, just taking the time out to be able to share all of that with us today. We are truly appreciative. So thank you so very much. Please take time in the to fill out the survey. If you are still on, it's in the chat, just to give us information and feedback about today's event so we can continue to serve you guys and be able to organize and plan other events like this. So thank you so much. And I hope everybody has a good night.